Good morning, ladies and gentlemen, and welcome to the webinar of Keren Hayesod, the world's leading fundraise organization for the people of Israel. My name is Freddie Hollander, and I'm the volunteer chairman of the European Initiative, a cooperative of all European campaigns of Keren Hayesod. And it's my pleasure to introduce Nadav Eyal. Nadav is, in my opinion, the best known foreign affairs journalist and reporter in Israel and beyond. He's the head of Channel 13 International News and the writer of the bestseller, The Revolt Against Globalization, in which he explains why the world over people are getting so angry. In preparation of writing this book, he's hung out, for instance, with miners in Pennsylvania, Molotov cocktail-throwing anarchists in Greece, neo-Nazis in Germany, Marine Le Pen in France, and many other fine species. In his distinguished career, he has interviewed 4 different Israeli prime ministers. So who knows after 3 elections. He holds a master's in global politics of the London School of Economics and fellowships in many other renowned institutions. Nadav is married to Tamara, and together with their 3 kids, they live in Bnei Tikva. His presentation will take about 20 minutes. And we have time to answer your questions at the end of this session. To pose questions, please use the Q&A button on the bottom of your screen, and depending on the time, we will get in as many of your questions as possible. So now let's listen to the man that you signed up for to listen to. Nadav, the virtual floor is yours.
Thank you very much, Freddie. Thank you. This is a short webinar. And it deals with the way that our world is changing, is reshaping before our eyes. And I want to start off by saying that we are in the midst of these events. They are fluid, and things that we might say or perceive now might not be, at the horizon, be fulfilled in full. And I'm not just saying this to cover myself. I'm saying this because we need to understand that this is an emergency. We are approaching 1 million confirmed cases of corona around the world. We are seeing hundreds of thousands of cases in the United States, probably less than half, or maybe less than a third or a quarter of those are confirmed. We are seeing the scenarios that are being presented by the White House to between 100,000 to 250,000 Americans dying from this disease in the next 6 months to 8 months, maybe more. We are seeing also in Europe, in some places, the tragedy of Italy, of course, and of Spain. There we see some sort of a flattening of the curve of deaths and confirmed cases. But still, we need to remember that even if this flattens, it doesn't mean that we do not see more and more cases. When we say the flattening of the curve today, we just mean that we don't see an increase, which is exponential, between the number of cases yesterday and today. But we still see in Italy, for instance, between 4,000 to 5,000 cases per day. And of course, a percentage of those will go into ICUs, and some fractions of percentages or more will die as a result of this disease, unfortunately. We know that this disease kills mainly people that have a background medical condition, and usually in most cases, more than 50% of the cases, people that are 70 years old and older than that. In Italy, the statistics is more than 70%. But we also know that this is much more lethal than the regular flu, even for young people. And the complications are as such that it demands our health systems so much, and they might collapse, and they have collapsed in several places in the world. And we expect this to happen again and again. We're seeing places in which, for instance, in the UK, we saw that some experts even started to say, the curve is being flattened in recent days. Then suddenly yesterday, we saw the numbers of deaths there and the numbers of confirmed cases. We saw articles about Germany tackling this, and people asking why Germany has such a low mortality. Well, its mortality has doubled in the recent week or so, And usually what we need to always remember is the timeline of the disease between infection, or at least between confirmed infection and death. We are talking about between 20 to 27 days on average, sometimes 17 days if the system is collapsing, sometimes more. But that means that we always need to look at the starting point, at the first 1,000 cases in each state, the first 100 cases in each state, then start asking questions about the curve and how we are progressing. I'm going to speak briefly about the way this changes our world of globalization and about the national security of states in this condition. And I'm going, first of all, to state the obvious. Right now, we have very limited globalization. And this is the first time in history, probably since World War II, that we had so little globalization. Of course, we had this also in World War I, but we never had this because of a pandemic. We didn't see a stop to international relations as such because of a pandemic, because we didn't have such a viable, a deep and expedient connections and interrelations between people and nations as we have today. We see this, of course, in air travel, which is basically dead. You know, these airlines are dead. They're just waiting for something better to happen, but they are stopping everything. British Airways just announced that it's going to basically put on hold all its 36,000 workers and more. And this is not the only business, of course, that will do that. We are facing an economic crisis of huge proportions. I do not want to use the terms that are usually used. I don't know if it will lead to a depression. We don't yet know what will be the meaning of a recession. And we have no idea if we will bounce back in 6 months after this will be over. But we do know that it is causing a recession right now. It's causing mass unemployment. And this unemployment will lead in the future to political instability. And this is not going to be a short thing. These businesses that are going bust, and I'm not talking about the big companies that simply don't have customers right now, but have a pile of cash, and they can somehow survive this, and they also have properties. I'm talking about small-time entrepreneurs, people that have their own, shops, people that earn money in places that give services. These people that have to pay their mortgages everywhere in the world are facing a very real crisis. And this is also a healthcare crisis. If we're talking about national security, the first thing I should say is that the biggest risk right now for national security beyond the pandemic is, of course, the economic crisis and the opportunity for extremists, fundamentalists, nationalists, neo-Nazis, of course, fascists of every creed, radical anarchists, to take this crisis and use it in the future to garner power. This level of unemployment is always leading, at least in modern history, to some sort of political instability. And this is the first kind of risk factor that we should aim for in tackling it when we talk about what's happening in the world in relation to the corona pandemic. Of course, another thing that we should always remember is the trust issue and the legitimacy issue. Right now, we are in the middle of an emergency, and we all hear the news about people not getting enough ventilators, about hospitals in the United States informing people in their ERs that they might not get care because doctors will deem them as people that might not survive this. We're hearing what is happening in Italy and in Spain. In Italy, they don't have enough ventilators. In Spain, they are disconnecting people from ventilators and letting them die in order to give the ventilators to someone else. And we, of course, know that the main problem is not ventilators. We will manufacture more ventilators. There will be supply and demand. The main problem is the medical staff that will issue these ventilators. But when we hear these headlines, we don't really comprehend what they mean for the public when the public will encounter these stories more and more, and maybe even, unfortunately, encounter it themselves or with their loved ones. The public will see that the state could not supply them with the means to survive this pandemic. At the beginning, it will happen in hospitals, but then if the financial crisis will persist, it will happen in other places. And therefore, the first thing that we should remember about tackling and about this challenge is that speed is more important than accuracy, and that perfect is the enemy of the good. We need to tackle these issues right now. We need to employ a lot of solutions, and we need to do this quickly, not waiting in our houses only in quarantine. This is, of course, essential, but this will not solve the problem most probably. We need to understand that 80% of infections in Wuhan, in China, and in other places are happening within households. And that means that even if we put people in quarantine, we will absolutely decrease infection level. But on the other hand, we shall also see that these households will become infected and some people will die. And because these households sometimes leave the house in order to buy food, sometimes to go to work. People still go to work in some sections of society. That will mean that more people will get infected and so forth. And therefore, the employment of new means, technological and otherwise, of increased testing, which is crucial, and of serological testing, which we are now awaiting, confirmed serological kits. The kits that have been brought from China in most places in the world have been shown to be faulty. I don't want to say that's generally on every kit coming from China, but we saw the Spanish event. We also saw what happened here in Israel. We tested a lot of kits from China. None of them really worked. I'm talking about serological kits that can see if you're immune, if you already had the disease. And right now, what we really need is real serological tests, not necessarily kits, not necessarily household kits, but some kind of a way to check people quickly and to move people that have already passed this back into societal life, because we need these people. We need these people who are already immune. So employing all of these elements, not only isolation, which is the main choice right now of the West. And it's very easy to say to people, you know, stay at your houses and maybe use the police and maybe the army even in Spain and in this country in order to make sure that they are staying in their house. But it's another thing to trace people, to separate healthy people from infected people, get them out of the house, something that most of Europe doesn't even try to do. The United States even isn't talking about that. And then treat these people, and then test people as much as you can in order to stop infection. These things were employed by Asia, and we are seeing what's happening in Asia. China might have not been telling us all the truth all along. China has asymptomatic cases. It does not report them, and they are infectious, of course. But we are seeing that, relatively speaking, Japan, South Korea, Taiwan, Singapore, China, all of these places have this under control because of the recollection of SARS. That means that we can get this under control, but what we are seeing is that the West is enabling itself to tackle this challenge, but it's doing so in such a not a hurried way. It's doing so slowly that we can really, when we approach this, we can ask the questions about, yes, why not use masks, 3 weeks ago? Why start talking about masks now? Why not use more testing a month ago when we all knew that we will need more testing? And so forth and so forth. So I see this in my country, in Israel, where we have the capacity today to have dozens of thousands of tests daily, and this is a small country. And we're not doing this from reasons that really I can go into, but they have everything to do with the health ministry here, which is a big bureaucratic institution, and it's very resolute that it doesn't want to do too much testing right now, unfortunately. And we see this in other places in the world, that they have not inhabited the technology and the system in order to do the testing efficiently. It's not only about doing the testing, it's also about doing this quickly enough. So we return to the issue of speed. This is a crisis that we cannot afford. We cannot afford globally to linger. And this is something that the Chinese understood very quickly, and the South Koreans, and the Singaporeans, and the Taiwanese. They understood very quickly that this is not something that you can just say, oh, we're going to live with it. Because in a couple of months, what we will see in economies is really real economy struggling, and to the extent that people might not have in countries that are less fortunate things to basically to eat. And those populations that might be immigrant populations, in my country, it's the ultra-Orthodox, some parts of the Bedouin or Arab populations, they can go to a point of not having money to pay their electricity bill or to buy food. And because of that reason, speed is of the essence, and we need to employ things that might not work at this point, but we need to check them out as quickly as possible. If we do not do that, we shall see a collapse of our global systems that are systems of supply and demand. And we need to understand that these factories sometimes cannot just be jump-started again if the supply dies, the supplies of their essentials in order for them to run, or if the demand dies. These workers who will be let out cannot necessarily always be rehired to that position. And there are costs to all of these things. What's optimistic about the situation that we are in is that, unlike other pandemics in human history, for the first time in history, we can say to people, stay at your homes, don't leave your house, and we, the state, will take care of you. And if you need something, and if you have a medical emergency, or you don't have food in your house, we've got the internet, we've got mobile phones, we've got systems that are digital, and we can tackle this. So what's really different with this pandemic, and that's different from the 1918 flu pandemic and every other pandemic in human history, is that for the first time in history, people can actually, in most countries, stay indoors in their house. And this is the reason that if we look at relative scenarios in the beginning, Mark Lifshitz from Harvard or Neil Thompson from the Imperial College, about how many people will be infected and how many people will die, they were spot on in understanding that this coronavirus, COVID-19, is going to be a huge global event. They were absolutely right. But their models didn't get something else. And that something is that we can actually go into quarantine. We can go into quarantine as societies. When China did that, people said, oh, this can only be done by the Chinese because it's an authoritarian state and no one will agree to do this in other countries in the West. Well, France is doing this, and Germany is doing this, and the UK is basically doing this, and Israel is doing this, and President Trump is still refusing to sign an order of indoors to all Americans, but I presume that at a certain point he'll do that too. And governors in different states in the United States are already doing that. And the reason that we can say this to people is that because people are, simply speaking, rich enough compared to 100 years ago, or 200 years ago, or 1,000 years ago. Of course, that was always a better way to deal with pandemics, with pathogens. Even 300 years ago, people knew, that if they'll stay in-house, indoors, they'll have less of a chance to get the disease. Sometimes they thought it was because of foul air or something, but they did understand that, but they couldn't afford it. And for the first time in history, we can afford it. And that means that we can be more optimistic about the results of this on the one hand. But on the other hand, and this is really important, we cannot sustain our economies for long in this condition. And therefore, the wait and see policy is not a policy when you tackle an emergency pandemic. When you tackle this event, and what I'm doing right now is quoting the WHO. I'm not making this up. This is not my analysis. I'm simply quoting Mike Ryan in the WHO and others who are saying, move fast, isolate the cases, get them, if possible, outside of their households. But if it's not possible, these households need to be at least virtually sealed No one should go out, and then you should supply these houses with food if needed. We need to do this logistically, because if the idea is to wait until this dies out or wait until we have a vaccine, the meaning of this would be absolutely detrimental to our economies and in a very bad way. And we will come out of this not only sick sometimes, but also much poorer and with less opportunity to treat those who need treatment. And we are really seeing the difference right now between East and West. And we are seeing that the West is not being as vigilant as it can. It's not employing enough logistics in most places, not in all places, in most places. It's not employing enough logistics in order to tackle this. And it's using mainly quarantine, starting to talk about testing and masks, hoping for serological tests. This is simply not enough in anywhere in the world right now. And this is something that we need to do ASAP. Another thing that we need to do is, of course, to have more international cooperation. The first hit was with international cooperation. Countries are making sure that they keep those supplies for themselves, those medical supplies. They are issuing protectionist moves in order for them not to be exported. This is, of course, very natural, and we can understand this. We can also understand that this will benefit the rich countries. It will benefit the bigger countries that have more diverse industries. France, Germany, the UK, the US, these kinds of countries that can produce everything they need in order to supply their medical system. But if we will go that route, the meaning of this for our global village would be that we shall see spillovers of the disease again and again, and more waves of the disease, because containment will become impossible. We need a level of global cooperation. It is very evident, and it's very understandable, that countries will not let go of this medical equipment. And it's very understandable that they're not going to sell to the entire world while their populations are in strife. But we also need to understand that they need to sell something to other places in the world, and they need to have some sort of a coordinated event, which right now we are not seeing. We are seeing the WHO, and they have their press briefings, but there is no global leadership, political leadership kind of cooperation saying, you know, you deal with these vaccines, we're going to produce this. We're not using the efficiency of the globalized world in order to fight this pandemic. We are withdrawing to the nation states. For some states, this is great. When you have 28,000 ICU beds in Germany, that will work just fine for the Germans. And we see that the Germans, for instance, understand what I'm saying, and that's the reason why they are airlifting people from Bergamo, Italy, to Germany in order to treat them. This is not only European solidarity. This is an understanding of how to fight this pandemic. But we need more of this approach. And if we won't have more of this approach, we will see more suffering. And in the end, suffering is not only a matter of this disease. We have the data coming from Italy. Most of the people who died above the average in Bergamo in the last month, compared to other years, did not die of the disease. They died because they had heart attacks and they didn't go to the hospital. They had strokes, or they didn't buy their medicines because they were quarantined and they were afraid. So what we are seeing is that the death axis, it's going to be much wider than we actually suspected at first. And because of that, speed is of the essence, global cooperation is of the essence, testing and serological testing is of the essence, and of course, God willing, having some sort of a medication protocol which will make this disease somewhat less stressful for our health systems, so we can have a turnout of people who have the disease, who are infected, out of our hospitals more quickly. Then we are not only flattening the curve, but also tackling the limits of our very limited resources. And if you have any questions, I'll be happy to start answering those.
Thank you, Nadav. And your presentation has answered many of the questions that were posed. But one of the questions that was raised, at the latter part of your presentation, you talked about cooperation. One question is, some of the world leaders use this pandemic to strengthen their grip on their nations. What is your opinion about that?
Well, of course, you know, people are saying populism is dead, nationalism is dead, you know, science has been proven right. Science rules the world right now, and we are listening to scientists, and everyone is basically listening to some extent to scientists, even President Trump. Even President Trump. And Prime Minister Boris Johnson that thought that it's a good idea to shake hands with corona virus infected people.
So did Putin.
Yes, but saying this, after saying this, we need to remember one thing. You know, these approaches are not going anywhere. People who think that in a year and a half, when really God willing or science willing, we will have a vaccine, these approaches are going anywhere. Well, they are just right now, they are just hiding in their holes. And all of this kind of fake news world is going to erupt. It's going to erupt in one of two scenarios. One scenario is the scenario of social instability, which will happen if we have this level of unemployment. In my country, we have 20 to 25% unemployment, and we didn't have any unemployment. We virtually had no unemployment. We had like 3 or 4% before this thing started. So when people will be unemployed for 2 months, they can survive that and they'll have their unemployment fees and so forth. But after 6 months, after 8 months and 9 months, this social instability will be used by populists and demagogues, by fake news in order to spread rumors and conspiracy theories and so forth. And the other scenario is much more positive. We will have a solution to this, and then people will look back and they will have a retroactive wisdom, and they will say, oh, you had to do this and you didn't, or you had to not sacrifice so much of our economy and listen to scientists because we had only put a number in this and this amount of people dead. Of course, if we wouldn't have gone into quarantine, we probably would have a million times more people dead, but nobody's going to listen to the scientists again and so forth. So to the question is, leaders are going to use this. Viktor Orban of Germany, of Hungary, is going to use this. Of course, authoritarian regimes are going to use this, but not only them. If we are using today mobile phone tracing in Western countries, and in Israel we're starting to do this, in order to prevent people dying from a disease, after the disease will be over, people will come and say, why not use mobile phone tracing in order to prevent car accidents by the state? And we can do that, actually. We have the technology to do that, to see, you know, if someone is a reckless driver, and we can combine the data. And more people are dying each year from car accidents than are dying from global pandemics that happen every 100 years, right? So why not use this tool, which infringes on everybody's privacy? And a lot of people are going to make this informed argument, and we need to think about that and be ready for that. So things are going to change. Things are changing. And of course, dictators and authoritarian regimes will use this pandemic in order to garner more support. But what we should be worried about is that in democracies that don't know how to act quickly in these cases of emergencies sometimes, and it takes time for them, if it's a world war or if it's a global pandemic, they cannot do what the Chinese did in Wuhan. We need to make sure that they act quickly enough and efficiently enough so people will not turn against their legitimacy and look for a strong man or a strong regime which will do what the Chinese did. We really need to be fearful of that. And the way practically to do so is to be more efficient, more quick, less bureaucracy in doing so, and do employ, as democracies, do employ emergency means and have them controlled by our constitutions and our courts.
Thank you. Another question that occupies people's minds is what is the development with our neighbors, Gaza, the West Bank, Syria, Jordan?
Well, this is a big question about Israel's neighbors, and the answer is that, first of all, in the Palestinian territories, we don't see an outbreak at the moment. Of course, we see sickness. We see sickness everywhere, but we don't see an outbreak of the disease the way that we are seeing right now in the ultra-Orthodox towns and cities in Israel. Israel understands that it's connected to the West Bank and to the Gaza Strip, and that it needs to support these places in order to prevent an outbreak of the disease and its own interest. So the Israelis understand that. Whether or not the government really employs enough resources to help the Palestinians and the Gazans with this, it's a question. They are, of course, allowing medical equipment and checks and tests to go into Gaza and into the West Bank, but this is not enough. This is not enough. And I know that the health ministry here in Israel is saying that they are very worried because of the West Bank, because the West Bank is not really disconnected from the sovereign Israel. And it's, of course, connected in East Jerusalem, which people need to understand. East Jerusalem have, that they have all, the rights as an Israeli citizens to move freely. And they're also Palestinians, and they do not recognize usually themselves as Israelis, and that's a big problem. So in this case, you don't get any discounts. There are no discounts. If you do not tackle everything, every part of the population that you're connected to, including in Western countries, immigrants, including places that you don't usually go into, then these places are going to infect other places, and that could have huge means for the entire society. So we need to really take solidarity here, not only as a society value, but it's also an epidemiological value in this case.
Thank you. One other question is probably a selfish question from the United States is, do you think this pandemic will have major influence on the elections?
I do, of course. The pandemic will have huge influence on the elections, and you need to wait and see what happens in battleground states in order to understand how it will influence. So usually people in these kinds of scenarios, they start saying stuff like Trump is never going to win, after what happened, or he's absolutely going to win if you talk with people who support him. I need to look at battleground states. I want to say something that people don't usually say. Usually people say when they look at this kind of events, they say everything's going to change, right? And I read these articles in the New York Times, MIT Review, and a lot of smart people explain that everything's going to change. And what my message is no, not everything's going to change. We're going to have left and we're going to have right, and we're going to have nationalists and populists and conspiracy theories, and we're going to have Trump. And people are going to look, and if there's a lot of disease in Pennsylvania and their feeling is that the federal government didn't do enough, Pennsylvania might turn blue, which it might turn blue anyway, these elections. If it happens to be that in Texas we don't have a lot of what we are seeing in New York, Texas will probably vote red again, and so forth and so forth. So you need to look at this on a state level right now. But basically, I'm not seeing right now the signs of a real shift in the American politics of electorates in battleground states. I expect that this shift is going to happen. And I think that if the federal government is going to handle this the way that it handled it until now, I will be very surprised if the president wins again and in the same majority as he did last time. But I want to see what they're doing. They already started changing what they're doing. And also they have some rock solid support in some parts of the American media, mainly Fox News. So I would like to see that first. But not everything's going to change after this pandemic.
The other thing that one of the questions is, what is this going to do with anti-Semitism? Because we already hear the ugly sounds of people blaming the Jews.
Yes. Well, blaming the Jews for the plague is a long tradition of the West, and only of the West, I should say, and or at least not of East Asia. It also happened in the Middle East, of course. But this will happen, and of course, when you see what's happening in New York, when you see in ultra-Orthodox communities here in Israel, you see that there is a risk factor for people who, or there was a risk factor for people who are Orthodox, and that's of course that they go to the synagogue at least once a day, or a lot of them go to the synagogue once a day, and they congregate. Most of them, of course, don't do that anymore. And in Israel, I should say that the rabbis, unfortunately, they didn't do that quickly enough, and they sort of did not listen. They did not heed to science. But they did order now that not only you do not go to synagogues, you don't pray with the group of the minyan of 10 people anymore at all. They even said it's a din rodef, which means that there's blood on your hands if you do that. So they understood that, okay? They understood that late. And I'm just saying this as a general background. I'm not explaining anti-Semitism. Anti-Semitism doesn't need explaining. Anti-Semites will be anti-Semites, and they will be blaming Jews all around the world. Right now, those bigots are really focused on the Chinese and the way that China contributed to this, China manufactured this. And of course, China as a government has a responsibility for not tackling what happened in Wuhan as early as it should. But I would always challenge people to say, what would have happened if this would have happened, you know, somewhere in the United States, which is not New York City or is not San Francisco? Wouldn't we have been seeing, you know, in some place in between East and West Coast, and most probably, or even in Florida, a community of, for instance, religious people that go to church, and we would see an outbreak of 400 and 500 people with a new virus? Can it be possible? And that the federal government would not have seen that until it would be 1,000 people. And that's what happened in China. So the Chinese didn't wait to have 10,000 cases. They woke up at 300 cases. And even if they cheated, so they woke up at 3,000 cases, okay? They didn't wake up too late. So this could have happened in other places. I think that this is one of the things that I talk about in my book, and it's due, I think, in the United States, in the UK, God willing, if everything goes fine with the pandemic and otherwise in 2021, is that in a global village, we need some global responsibility. And that means that if there's a village, if we're all living in a village and we air travel all the time and we buy things from AliExpress, and there's a house in the end of the village, and suddenly there's a plague there, there's a disease there, the people in the house cannot simply shut their doors and shut their windows and say, oh, you don't barge in, you cannot ask any questions, and we're going to tackle this disease inside our house, and then daily go and drink from the village well and dwell with the other villages. This doesn't work like this, and it cannot work like this anymore, because we will have more pandemics in the day after, and maybe even quicker. And secondly, we will have wars. Or we will have global recessions, because it's really the same thing. If we have a global village and a global economy, and we need some global responsibility. So we need a responsibility, a sovereignty. You can knock on the door of that house, China, and say, look, we heard that there's a disease in this house, and we need to monitor this, and maybe we'll have something to say about that. And if that country doesn't want to be part of the system, you know, it doesn't get to be part of the global village. Now, I understand that what I'm saying right now is very radical. I'm talking about a sovereignty which is beyond state sovereignty. But if we don't have this, next time it's going to be a local war that develops to a global war. Next time it's going to be a local financial crisis like we had in 2008 that develops into a huge, big recession, and so forth and so forth. So we need this global responsibility, and we need a different sovereignty in the world. And radical as it might seem, it's actually not radical at all.
Two more short questions. The relation and the situation in Iran as against the rest of the world.
Iran is hiding the true numbers. What's happening in Iran is terrible. Iran doesn't have a health system that can collapse to the sort of health systems that we're talking about. I expect that if there is a place in the world that we shall see a herd immunity, the first place of that, a herd immunity which is not part of a vaccine. The best way to get a herd immunity is by a vaccine. This is how we want to get it. We don't want to get it by having 60% of our population sick and then 0.4 or 0.3 even of them dying, because this is going to be terrible for everyone. But the first place in the world that might have herd immunity is probably Iran, because they cannot tackle this. And people in Iran are not rich enough to be quarantined. So Iran is really, if you look at it, is really the first country which is not completely developed. It's not also a classic southern, global southern country, but it's not fully developed, that is having this disease, this epidemic, and dramatically speaking in terms of infection. So it's the first case study that we have in that sense. It's a very unfortunate case study, and I feel for them, but that also means that we will have to look, at what they've been doing and how much immunity they are going to get. I suspect it will be quickly, and I suspect they are hiding not thousands more of the deaths, but we estimate in Israel that we're talking about dozens of thousands of deaths there.
The ultimate question, or the last question, is we have been dependent, the West, on manufacturing in China. Do you think this pandemic will change the manufacturing and trading relationships between China and the rest of the world?
I really don't think so, unless we will see a dive into a protectionist world after the pandemic. This can, of course, happen because we are on the route to a protectionism anyway. So you remember me saying not everything's going to change. Well, we were on the route of protectionism, with all due respect to the China-US trade deal. Everyone in the world felt what The Economist has been labeling slowbalization, not globalization, but slowbalization, the withdrawal of globalization. So the pandemic might make that trend stronger. But generally speaking, and maybe we have on the line people that are entrepreneurs or own factories, strictly speaking, economically, as long as it would be cheaper and more efficient on the short term to produce in China, people will produce in China, right? And they will use this. And it's really not very efficient to say, I'm going to protect my industries because I need to have local industries for the case of another pathogen coming in 10 years or in 50 years or in 100 years. So it doesn't save anything. It will risk lives. It will cost lives because of you having less money for your population. And of course, this is becoming North Korea. We don't want 10% of North Korean model. We don't want 5% or % of those. And by the way, we don't know what's happening in North Korea, but I suspect it's terrible anyway. So the answer to the question is that I don't believe that we will see a real move to a protectionist, grow it all yourself economies, A, because we cannot afford it, and we won't be able to afford it after the pandemic with this financial crisis. B, it will be always cheaper to produce in places that are more efficient in terms of labor costs and in terms of general efficiency of the markets. But I should also say that if you look at the costs of manufacturing, not in only in China, but generally speaking, these costs, the margins are getting closer and closer between East and West. So generally speaking, we see more factories saying, oh, we can produce in the US, get a tax benefit, or we can produce in Malaysia and get less of a labor cost. So the pandemic might cause this to be more of a cutoff than it was before, and we should look at this. But basically, stuff is going to be continuously manufactured where it's efficient and cheaper on a short-term basis. And this is true for real economy as it is true for financial markets. Always short-term profit is more important for the markets and for decision makers than long-term profits, because you don't know what's going to happen in the future. That's the problem with it.
People will be people. Nadav, thank you very much for a reality check in these difficult days for all of us around the globe.
And I want to just say to all the people that have been listening, thank you, and I hope you take care and do your best to self-quarantine.
I'd like to add to that, thank you all for joining us. Please don't forget, next time you want to support the people of Israel, do contact Keren Hayesod. We're here for you and for the people of Israel. And let me say goodbye, wishing you all a happy and foremost, a healthy Pesach. Thank you.
Thank you.